The Omicron variant is here in Ontario. Other than that fact, there are far more questions than answers on what it actually means. The province's top doctor acknowledges the 2 cases discovered in Ottawa could be just the beginning.
I would not be surprised if we find more in Ontario.
In fact, there are 4 other cases under investigation for the new variant, 2 in Hamilton and 2 more in Ottawa. The first 2 Omicron cases were announced yesterday in 2 people who had recently traveled to Nigeria. One concern is this variant could be more transmissible than the Delta, but there is an even bigger fear.
Could some of these mutations actually result in what we call immune evasion, which means that you could be at higher risk of reinfections, but also vaccines may not be as effective?
Ontario has seen a steady increase in COVID cases in recent weeks, which was expected as the weather got cooler and restrictions eased. The Chief Medical Officer of Health doesn't believe adding province-wide restrictions is necessary, at least not yet.
I don't foresee us having to take any steps back at present. We will, though, need to completely understand if it's more virulent.
The provincial government, however, is strongly suggesting it will expand 3rd doses to offer people greater protection.
We're also looking at other age groups for the booster, the 3rd dose booster. We'll have more to say about this later on in the week.
The Omicron variant was first discovered in South Africa, but has now been detected in several other countries, including Germany, Australia, Belgium, Israel, and the UK. Dr. Kieran Moore says public health units are reaching out to 375 travellers in Ontario who have arrived from countries that are deemed high risk for the variant. He's also encouraging the federal government to enact tougher testing on travellers.
We really do need enhanced testing of returning travellers. We're pushing that.
The opposition, though, wants the Ford government to be more proactive. All 3 parties are calling for paid sick days and greater vigilance.
Public health measures that we know protect us. Masking, vaccinations, social distancing, taking a look at the size of crowds.
So, status quo on province-wide restrictions in Ontario for now. However, different health units that are struggling with increased cases can enact tougher measures. Remember, the Ford government said proof of vaccination in bars and restaurants could be eased by mid-January. That's not looking likely at the moment. Dr. Moore believes it will be at least a couple of weeks before more is known about the Omicron variant, how virulent it is, and if vaccines will be effective against it.